afternoon, everybody. My name's Andy Bleeden. I'm the Director for Ecosystems and Membership at the European Connected Health Alliance. I'm pleased to welcome all of you along to our session today, which is a pop-up ecosystem focusing on dementia and dementia particularly during COVID times. Just a little bit about ourselves, for those people who have joined this webinar for the first time, a little bit about the European Connected Health Alliance so you know more about us. We're a member organisation, a not-for-profit member organisation, representing well over 700 organisations in the digital health and social care field. We also have a large contact database of professionals in the health and social care field of around 16,500 people. And as I said, we're a not-for-profit organisation based both in Dublin and in Belfast. We're involved with many European initiatives and now many global initiatives as well around the field of digital health and social care. But what we're particularly involved with is services for our members. We actively promote our organisations, many of whom are on the call today. And becoming a member of the European Connected Health Alliance allows you to promote your organisation and get connected. We've just recently launched a brand new service, which is a monthly funding and collaboration update for our members, which we've published now for the first time this month. And we encourage you to join up and join our global partnership. A little bit about what we do as our organisation. We are very, very well known for organising our permanent multi-stakeholder ecosystems. These bring together all of the stakeholders that are involved with both health and social care. Never has this been more challenging than during the current pandemic, because this is a challenge that we've all had to rise up and meet. Ecosystems exist to break down silos that exist in health and social care, but also to transform health and social care. And particularly around the field of dementia, that's very important, because certainly my background in the field of dementia has seen enormous change in the way that we work in the field of dementia. And I work with many of the colleagues here today on this field. But lastly, our ecosystems are there to create economic growth. So we work very actively with companies and SMEs in health and social care, because the majority of spend, especially in the field of dementia, is on social care for many nations. And so that represents an enormous economic opportunity for both regions and nation states and Europe as well. Our ecosystems, as you can see by the diagram, include all the stakeholders in digital health and social care, and usually meet in face-to-face gatherings all over the globe. And I'll show you where those are in a moment. But for now, these sessions will be online. And they'll be online. And what we've found is there's a really exciting opportunity because of the crisis, where we can bring together members of our ecosystem network together in a way we couldn't have done before because of the cost issues of bringing people together. And so we've built and developed these pop-up ecosystems to serve that purpose, both for now to target COVID-related themes, but also as people move back to traditional services to carry on that work and program of developing pop-up ecosystems that are both thematic and also geographically based. And we've got a new program which I'll talk about in a moment. Our ecosystem network is growing as we've never seen before. And we've just proudly welcomed in our newest ecosystem member from Lithuania. And if you're listening today, welcome. 24 months and never so busy as in the last 6 months as people realize the potential to collaborate and work together. We've developed, as I said, a program of pop-up ecosystems. Our next one after today will be on June the 24th, and that's going to be on the field of, or on the theme of data and data donation and what's changed. There's been a lot of talk about data and how things have changed from the world of data sharing to that of data donation. So that's going to be on June the 24th. Following up from that, we've got a really exciting pop-up ecosystem, which I was organising yesterday with colleagues from Canada, with Techno Montreal, soon to become our latest Canadian ecosystem, who are wanting to run a pop-up ecosystem focusing on collaboration between Canada and Europe. And I know many of our members and our partners are involved with collaboration with Canada, so that'd be of enormous interest. And that's going to be themed around the field of isolation. Then following that, we've got a purpose-built ecosystem around one of those pertinent issues we've seen in the COVID-19 crisis, that of matching demand and supply, and how different regions and nations and also global players have come up to meet the challenge of matching supply and demand. Following those, and you can register for those on our website, we've got a series then of thematic and geographically based ecosystems. We're very pleased to be connecting up with our Australian ecosystem in Melbourne and targeting the field of telemedicine with our ecosystem there. We'll give you some dates on those as and when we get them. As many of you will have seen, we've been working very closely with partners in Latin America, in Mexico, Argentina, Chile, and Costa Rica, and Brazil to develop a Latin American ecosystem network there. And we've got the next of our Latin American multi-ecosystem meetings happening, hopefully, either side of the summer. We'll come up with some details for that. Our last ecosystem is our mental health. We're going to be featuring a series of features on mental health and COVID, because we know and we've heard from our members this is a vital issue and one which we want to return to again, whether it's around isolation or medication or lack of services for people with mental health problems. Then I'm pleased to announce this week we finally agreed a date with our Greek ecosystem partners to launch a Greek-focused ecosystem in September. They've been running for some years, and this will be focusing on telemedicine and their road to get towards the telemedicine, which is going to be quite exciting. And then we're looking then to build and plan for pop-ups in both the Highlands Islands in Scotland and in Lithuania. However, today is on the field of dementia. Many of you will have seen dementia being mentioned in the press recently because of changes in the way that either people are accessing care and support if they're living with dementia, or services and support for carers of dementia have dropped in many areas as people struggle to come together. Many of you will also have had your own national headlines and crises in care homes, etc. But we've also seen with some other groups exciting approaches to tackle COVID-19 for people living with dementia head on. And that brings us on to today's program. And we've got, I think, a really exciting program. So we have got input from both European funded programs, from our members as well, and also the announcement of some exciting work that's happening in Italy. So what we will do first is go to our first speaker, who I'm proud to announce is Henriette Hansen from the South Denmark European office. Henriette, I'm going to ask you to introduce yourself and your topic, please. Just while you're changing around, just to introduce, we've been working with the Southern Denmark office for some time now, and we're proud of our collaboration there with South Denmark, one of our strong ecosystems. So Henriette, over to you. I'm going to shut off my screen.
Okay, fine.
And I'm going to silence.
So I will try to share mine.
And don't forget to introduce who you are as well, please, as well.
So, yes, hello everybody. My name is Henriette Hansen, and as Andy said, I'm working for the South Denmark European office. And I have been invited to this webinar today to tell you about a European project which is called Embracing Dementia, where we are working with new ways of gathering community resources and develop training and information material about this area. So I'll just start shortly to tell you, yeah, Embracing Dementia, in short, we are calling the project Eden, which is of course a very nice and positive name. And Eden is a European collaboration project, and it's developed within the Erasmus Plus program. Erasmus Plus, for those who do not know, you probably know about all the students traveling around Europe in Erasmus mobility programs, but you can also develop innovative programs in Erasmus Plus, focusing on capacity building, providing training, information for all people in all ages, from before school up to older people. And this is why we have focused on Eden, because we are focusing on people living with dementia and the relatives taking care of their family members living with dementia. And we have partners from Denmark, Netherlands, and Italy, and then ECH Alliance from UK. Oh no, sorry, you're from Ireland now. We are very sorry that this has happened, but good that you moved to Ireland so that you can still be a part of this European community. And the idea to Eden was actually born within the ECH Alliance network, because back in 2017, I joined a conference in Brussels where we were talking about mental health. And you had invited a speaker from the UK, and she explained all about her experiences being a relative to a person living with dementia. She told us all about how difficult it was to find out what to do, to get information, to get some knowledge, to find out who to collaborate with, and how to be best collaborating with the healthcare system and so on. And I was sitting there as a participant in this conference, and while listening to her, I was saying, all this need of knowledge and information and creating better collaboration, we could do a European project about this. And so it went, and we went together and developed Eden in our partnership. And the main background and approach in Eden is that we want to focus on dementia, that this is not a challenge for the individual, but it's a challenge for the community. How can we collaborate in a community, in an alliance, you could say, in order to provide the best possible care for the person living with dementia in his or her own home, but at the same time also providing help and assistance to the family members, to the relatives, taking care of that person. We know that it's really important that the relatives has a good support, because the healthcare system is really depending on them. It's a lot of resources that are being brought on an individual basis, and as people working on a voluntary basis into the healthcare system. So it's really important that we keep these persons working around the people living with dementia, that we keep that people within the system. And in the project here, we are focusing on gathering as much knowledge, both on a European level, on a national level, on a local level, to help the relatives taking care of their family members, but also to help install a good relationship between the relatives and the professional caregivers. This is really also a very important point. And we want to give a holistic approach, saying that the relatives and the healthcare professionals, they are not individuals, but they are individuals, but they are working in a community, and we need to to support all these community structures in order to provide us best health care as possible for the people living with dementia. And these are the objectives of Eden in a visual way. So we are developing and focusing on learning programs for the relatives. We are focusing on developing learning programs for the professionals, but also a very important focus in this program is also the civil society actors, where there are a lot of different organizations providing help to the relatives, but also to the people working living with dementia. And as you can see, we are trying to build up this project on co-creation perspectives, and the objectives, you can see them in the middle. So it's a more inclusive and dementia-friendly community that we want to build, improve quality of life for persons living with dementia and their relatives, and we want to help sustainability healthcare programs with this program. We are working in an action research way in this project, and also, as I said before, with co-creation methods. So our project is built up. In the beginning, we made a mapping of all kind of relevant material that could help and give information and knowledge to both the relatives, but also to the healthcare professionals. We were building on a needs analysis, saying what is it actually which is needed for the actors around the people living with dementia. How can we help them in the best way? So this was the inspiration phase. Next, we are in the middle of our ideation and development phase now, where we are gathering all this material that we have found and presenting it in a user-friendly way, so that relatives and also health professionals can actually have access to all this material, what has been developed in Europe around this area. And then we are also developing a community collaborative concept, where we put a lot of methods and concepts together to help communities look at this challenge with people living with dementia as a community challenge and not an individual challenge. And all the knowledge and material that we will build in the project, we will put it on the Eden platform, which will be a technological web-based platform where you can find all the information. It will be in different languages and so on. Next, we hope that it will be after the summer holiday. It depends a bit on this COVID situation, because it's difficult for us actually for the moment to work with the local test sites. But we have 4 local test sites in each participating country, and they will try to work with the materials, the concepts, and the platform that we are developing, so that we can see, does this really work for the target group that we are working with? And they will use this material actually to build local solutions within their own local communities. In the end, we will include all the experiences, and if we need to fine-tune all the material, it will be done based on the real-world experiences that we have gained with our local test sites. And then we will ensure that this can be some material which will be able to be upscaled in other parts of Europe, and make sure that we make recommendations on how this can actually be transferred to other countries in Europe and other local communities. So we have 5 main deliverables in Eden. As I said, we are working on this needs analysis. We have been out in each country to interview the target groups. So both some people living with dementia, their relatives, their healthcare professionals, and really making sure that we build this project on real and experienced needs. So we have developed the first draft of the learning and information material, and we are building this Eden community collaboration concept, which is a concept where you can, it's a co-creation concept, where you can put all the different actors on community level into a process where you can build a dementia community-friendly community, you can say. And then we are developing policy and implementation recommendations and the Eden interactive learning platform, where we will gather all the material from the project. For the moment, as I said just before, it is a bit difficult for us to get in contact with people living with dementia and their relatives. We have experienced that this COVID-19 crisis has made the people living with dementia and the relatives a bit more anxious. Who's getting into our homes now? Is it okay to let people in? Can we talk with them and so on? So actually, for the moment, we are a bit stuck in our project because it's difficult to get into the test sites. But we have also seen that a concept like ours, where we are building a dementia-friendly community and getting all people together, is actually also what is needed in these times, where people need help from each other and support from each other to do the laundries or go out shopping for people and so on. So the way that we are building this community concept can actually be very helpful in these kind of crisis situations. The vision for our Eden beyond the project period is that the platform that we are building now, we hope that it can become a kind of European reference framework where other regions and local communities around Europe can use it in order to build up a frame with useful information and material which can help local relatives dealing with persons living with dementia. It can be used as a frame to help the relatives navigating in their local environment. So we hope that that this frame can be used for that in the future, so that other local communities can actually be members of this Eden platform, and we can create a kind of knowledge framework where we can share experiences and local actors can help each other through that framework that we are building on the platform. We will make sure on the platform that there will be linked to local, regional, and national knowledge and information, and also linked to local support structures, where other communities can also bring all these kind of structures into the platform. And then making sure that we can create better collaboration between relatives, care professionals, and civil society through that platform and a kind of reference framework. It's very important that we can learn from each other in this area, and we hope that that this Eden platform and framework can actually inspire us to learn a bit more from each other, the ways that we are dealing with it, the material that we are developing, training material, knowledge, information, and so on. So we hope that that this platform actually will have a life after the project will end in the end of next year, because we have got 3 years prolongation, as it is difficult for us for the moment to work with the COVID-19 situation. So if you want to know some more, we have a website. It's still under construction, so please bear with us if everything is not working perfectly for the moment. I'm managing this project together with Kim from University College Lillebælt in Denmark, and you are very much welcome to contact us if you want to know more. You can also drop me an email if you want to be part of our newsletter, and then of course you can also take contact to ECH Alliance, who is a partner in the project, so they will also be able to tell you a bit more about the project. So I think I've used my 10 minutes. So thank you very much for your attention. And I will try to see how I can stop share my screen now.
Thank you for that, Henriette. Really, really informative presentation on it. I'm proud to be a part of the group that met for the kickoff for this project, and also proud to proud to be involved in what is an important co-creation program targeting both the community of support and carers, but also people living with dementia, and that's vitally important. One of our exciting projects there, targeting dementia. I'd like now to move on to introduce Wendy from Tunstall. Wendy's here to talk about the launch of their brand new white paper, which is targeting telecare transformation report. Really helpful in terms of looking at independence for older people living at home. Very, very vital considering the target theme for today, which is dementia. I recommend you have a look at this and obviously listen to what Wendy's got to say. Just Tunstall, one of our, we're proud to announce that one of our ECH Alliance's strategic partners. And this report is, I think, quite interesting to find out about, especially for the examples it gives from the UK and Spain. So Wendy, I'm going to ask you to introduce yourself and open up your video, please, as well. And I'll hand over to you, Wendy.
Thank you, Andy. Thanks, Andy. Yes, I'll introduce myself. I'm Wendy Higos-Contreras from Tunstall. I'm a Global Proposition Director looking after independent living. And I'm very glad, and thank you for the invitation, that we can share the outcomes of white papers on the transformational potential of advanced levels of telecare that we just published last week. I'll just give a very short introduction, explain something more about what advanced levels of telecare are to Tunstall, and then I'll show with you what the outcomes are, the main outcomes of the white paper. And then, of course, I'll also give you a short user journey of how that looks like for people with dementia and specifically for their family and carers. So if we look at the advanced levels of telecare, what it is I think most of us are quite familiar with the basic telecare service, where we have a service user, of course, to begin with, having some level of dependency, living alone or accompanied in their own home, and having access to an alarm device, a hub in this case, and a personal alarm button so they can raise an alarm whenever they need to. And by doing that, having access 24 hours a day to a response center who can then mobilize whatever action is needed, whether that are service elements as first responder services, or mobilizing and informing family and friends, or even coordinating emergency resources as our ambulance or police, for example. If we go to the next slide, we'll see what the difference is in the different tiers, as we call it, moving from reactive telecare to proactive and personalized. And the way this was developed originally in Spain originates that from before 1994, so quite a while ago. Their Spanish market, or their telecare market, was also on the reactive level, providing basically response service in case of an emergency situation where a service user would raise an alarm or a sensor would trigger an alarm. And then there would be a connection to a response center, and any service would be provided. From 94, it was then moved to the proactive service level, where the difference is that instead of only waiting for an emergency situation to happen, there's much more visibility on the service user's situation, and by that being able to have a higher prevention of risks and further enhancing well-being. And the way that that is done is that proactively there is much more contact, so there are more outbound calls instead of only waiting for inbound calls. And then from 2016, that further developed into personalized telecare, which has a very person-centered approach, where it's not a one-size-fits approach anymore, but there's actually there's an assessment or a stratification to first assess what the service user's specific needs are, if there are any high risk levels, and if that service user would then have a need, for example, for specialized services that could be from suicide or elderly abuse, for example, or in this case also for family and carers that care for people with dementia, a specialized support program for them. And by doing that and providing the personalized service, that also provides a more efficient and sustainable care model, as we can in that way provide exactly the specific service and support that is needed. So if we move on to the next slide, I'll then talk a little bit about the white papers. And of course, we have limited time, so I'll just go through the headlines, and they are available to you if you want much more details, and can also reach out after this session. Actually, the white papers were built out of 3 studies, one focusing on reactive telecare services, research done by YHAC, York Health Economics Consortium from UK, studying on service users with access to telecare and wider social care services of Lancashire County Council in the period of 2016 to 17. The second one being research study focused on proactive services, study done by Ignetica, an independent research and consultancy agency from UK, studying the service users and the operational and economic model provided by Tunstall Televida in Spain. That was between 2011 and 2018, including over 250,000 service users at that time. And the last study, also focusing on proactive services, was done by the FSIE, part of the Autonomous University of Barcelona, also studying on the service users in Spain, a total of 12,000, by a PROMS study, focusing much more on the perceived improvement on users and their families and carers in 2016. And then all of these studies were analyzed by Ignetica, and the actual white papers were made with the outcomes that those studies combined have provided. Eventually leading to benefits and showing the wider areas of benefits, leading to more integrated health and care demand management for an aging population. Now this, what I need to say is that these studies did not focus specifically on people with dementia, but that user group was included. And I'll show you some practical examples on what the benefits for that user group is specifically under this model. So going to the headlines, looking at reactive telecare, and we've just seen that that's really the basis of all telecare services. This was actually the study focused on Lancashire County Council in the UK. Benefits proved that per service user per year, wider social care costs were avoided of around £4,500, being €5,000, and that amounts to over 13 million and over 13 million pounds and nearly 15 million euros of annual efficiency savings over the wider population. And that just focuses on Lancashire County Council and the population included in the research. Then by adding proactive telecare benefits from Spain in this case, it was proven that and that focused very much on the benefits of providing proactive telecare and the effect that that had on the length of stay in the telecare service, improved 8.6 months delay to a residential care entry. And then calculating on that, with an assumed the daily cost of residential care that amounts to £5,900 per service user, over €6,500 per service users of costs avoided. And then the FSIE study, focusing much more on the perceived improvement of quality of life, have shown, also the Ignetica study showed that there was less demand on emergency response, over 50% reduction in emergency calls and over 36% in ambulance call outs. And then the FSIE study proved 98% of perceived improvements of families' peace of mind, and other areas of improvement where the service user themselves actually stated that they noticed a positive benefit of having access to proactive telecare. So the three studies combined have really led to these outcomes, not focusing only on the socioeconomic benefits, but also on the more personal and perceived improvements, really covering a broader array of benefits to users, carers, and health and care systems. And as it's also an international study, it has elements to it where we're proud to having discussions also to see how this can help other territories and other healthcare systems. This can easily be reproduced in other healthcare systems. And here then we also see how those different tiers of telecare build up. The studies have focused on reactive and proactive, and there's some elements of already personalized telecare in there. And at this moment in time, we're also further developing that onwards to predictive telecare. And also now under COVID-19 have of course further developed the proactive and personalized telecare into specialized programs and support programs for service users that are under difficult situations, as is social isolation. So if we look at the outcomes, I think this is a very good graphical view of the benefits areas where, as I just mentioned on the left, there's a focus on the benefits for users and carers, providing better support for them to live safely and independently for longer. And I'll just go through some of the details on that part of the study from FSIE. And then in the middle, we'll see the positive benefits on the avoidance of costs on wider social care services, and the delay or avoidance of residential care requirements. And then on the right, also showing the additional benefits to healthcare in the reduction of emergency services, and also some additional allied services. So showing both elements, one on the actual service users and their carers, and the other end on the social care and healthcare ecosystems. So we go through these piece by piece. The first study from RIHAC in the UK. As I mentioned, that lasted from 2016 to 2017, was a controlled study with 2 controlled groups of 2,900 users, included one part of the users having access to telecare and the other part not having access to telecare, but all having access to additional social care services, for example, domiciliary care or personal care in the home environment. And analyzing these costs, and of course the white papers have much more analysis and background information to this study, but analyzing the difference shows that there is a avoidance of additional social care costs of £4,500 of net costs per user per year. So a person that makes use of social care services and additionally also has access to a telecare service. That's just a reactive telecare service. Spends £4,500 less per year than a person without that access to telecare. Which, if you would translate that to an entire population, of course, is quite a big efficiency. Then looking at proactive telecare in Spain, research done by Ignatica, including over 250,000 service users in the period of 2011 to 2018, that focused on the length of stay in the telecare service and differences throughout those years, and focused specifically on if there were any effects on the delay or avoidance of residential care requirements. And what you can see here, and then also on the avoidance or reduction of the demands on wider health services, which proved to be true. If we can go to the other slide here we can see that in a graphic. So delaying the need for residential care, as we just saw, that is a delay of 8.6 months in average, specifically for the user group, service user group, that would eventually develop a need to go into a residential care facility. So what we can see, and I cannot really see this myself because I'm blocking this, yes. What we can see is that there is an initial delay that is an initial delay of 1.5 year transfer, which actually 1.5 length of stay, 1.5 years longer length of stay in the telecare service throughout those years for all service users, and then an additional 8.6 months or 0.7 years for that specific part of the user groups that eventually develop a need to transfer to residential care. Now, if we assume a daily cost in this case of £84 a day, then that sums up to £5,900 cost avoidance for the service user. And of course, that's quite a bit of amount, but also, of course, a big impact on a personal level, being able for a person to be more independent for longer and be able to live safely and healthily in their own home for longer. Then if we look at demand for other services, there was a reduction in emergency services, one being that ambulance mobilizations fell by 36% and overall mobilizations reduced to 24%. Which of course, and we do not have the exact numbers of that, but both the extended length of stay in the telecare service, avoiding or delaying the need for residential care for over 8 months, and then also avoiding the additional need for emergency services also has a positive effect on avoiding bed blocking. So bed blocking in hospitals, for example. So we do not have any specific numbers on that, but of course that is an actual problem today, which in the white papers are also included as side effects to the studies that have provided these numbers. And then if we look at the last study, and this was by the FSIA Foundation of the University, Autonomous University of Barcelona, and the PROM study of 2016. This focuses on the perceived benefits, so interviewing the service users themselves, 12,000 in total, where they actually themselves say that they have perceived improvements on a wider area, being more self-sufficient and independent, having less have a feeling of loneliness, and for their family and carers, they themselves feel that they have a significant improvement in peace of mind. And if we look at that in, yes, if we can go to the next slide, please, and look at that in a graphic, then we'll see that what's really the most significant improvement is perception of families' peace of mind, with 98% improvement, but also the other areas of perception of safety, self-sufficiency, and the perception of not being alone, somewhat less, all show areas of improvement. Having access to the telecare services as provided in Spain on a proactive and personalized level. Now, it's also good to say that as at this moment, and the findings are delayed because of COVID-19, but will now also include the effects during COVID-19. This study is actually done again. So this was from 2016, and it's now done again to look at the renewed findings. Now that, of course, this model has progressed as well. And then on a more practical note, to look like, so we've seen a lot of figures and we've seen a lot of numbers and socioeconomic benefits. When we look at what this really means on a user journey, as I said, this study and the white papers have not focused on people with dementia alone or their families and carers, but they are indeed part of this service model. And if we look at the next slide, I've included a practical user journey, how actually the support level is determined for, in this case, a carer living and caring for her partner, Maria. She's 65 years old, and her partner, George, who's 70 years old. Looking at the different areas, social inclusion, health, and the home environment, specific risks are determined. And in this case, it is proven that Maria actually experiences intense burden and exhaustion. So her dependency or her health situation is affected by the fact that she is taking care of her partner with Alzheimer's. He is mobile and wanders off, and that makes that, looking at the risks of Maria's situation in this case, it is recommended that she gets access to a support program with a high level, which means that she will get interventions every 15 days, will have access to a specialized operator who knows both her husband and herself, has access to technology where the hub that is normally provided in this case has no vocal instructions, that is not to cause any disturbances to George. They will get access to a bed sensor for George and a mobile alarm with GPS location for George, so that would provide more peace of mind to Maria, being able to sleep more easily with a higher sense of peace of mind, not worrying that he wanders off in the middle of the night. And she'll have access to elderly campaigns. Let's talk about campaigns. And also we'll be providing a platform with online training material. So it would be interesting to maybe see how we can feed in, or you can feed in to our online platform from the Eden initiative, with different campaign themes as healthy nutrition, and also different training themes. Activate your mind at home, for example, or self-support for carers. So very much tailor-made to the specific group of carers, family and carers, taking care of people with dementia and experiencing the need for wider support to be able to cope with that. And then if we look at the second slide, where the user journey takes us in the risk analysis of the home environment, then there are different areas where it could be that the outcome is, okay, George has symptoms of wandering, and there are additional elements which then in fact makes the home environment appropriate for George having a bed sensor, but could also be for them having an additional smoke detector or a mobile alarm device, for example. Now, the model provides in a specific profile with an advice on the program that both George and Maria can participate in. And of course, it's also up to George and Maria what program they really want to make use of. But this is a practical way of how the specific user needs and the person-centered approach looks like for people with dementia and their families and carers under proactive and personalized telecare service. So I would like to thank you for your time. And of course, we only had a limited time to go through the highlights. If there's any need for additional information or any questions, we can have that afterwards, or you can always contact me or have access to the white papers.
Thank you for that, Wendy. Very, very informative. And I think the links there for people who just told the slide there, we'll share the link for the download for the white paper as well. I just personally like to thank, I think that's, after years of working in the digital health and social care field, it's important and vitally important. We've now got demonstrable proof of the value of healthcare, both in terms of, I think, you know, for years we've fought the battle of trying to say this will actually help delay residential care and help the need for additional service. And I think what you've pulled together there are those 3 reports is, I think, really useful ammunition to help speed up the deployment of telecare. And so thanks for Tunstall. There's obviously, I think, you know, a need to connect the dots here. As you've said, there's obviously obvious links and connections with our previous speaker, Henriette from the Eden project, in terms of reusing some of this material for helping communities, but also for our next speaker, who's Stefania. But thank you for that, Wendy, very, very helpful. And hopefully we can connect the dots and learn from this and not have to reinvent another study, but keep these results in mind, because I think you've nailed it in one go. So thank you very much for that, Wendy. I'll ask you to turn off your screen now and invite Stefania to take the floor and tell us about another European funded program called ValueCare, which is funded by the Horizon 2020 program. And specifically, you've got some, again, you'll see this quite often now, activities around co-design around the field of dementia. So Stefania, over to you. You need to turn on your screen. I'll turn off mine.
Thank you very much for this invitation. And my name is Stefania Macchione. I work as a psychologist and a European project manager of Junior at FABER, that is a European center in Israel, and in Dementia Care Center. I'm really happy to tell you about dementia, but especially about ValueCare project. That is, as you already told, a DTH call of Horizon 2020. So ValueCare is a project that aims to deliver outcome-based integrated care to older people in order to improve the quality of life of them, but also of their families, and focusing on what matters for patients. So this is the core of ValueCare project that involves 17 partners from 8 EU countries, led by the Erasmus Medical Center in Rotterdam, and also ECH Alliance is one of our partners in this project. What's the mission of ValueCare project? So I would like to highlight these 4 points. One is to enhance the experience of older people with frailties, especially mild cognitive impairment, but also other kind of disease, and through an innovative digital solutions, so also fed by AI, so artificial intelligence. Then another mission is to improve satisfaction of the care team, because sometimes we know, also in my clinical experience, that there is a problem about their satisfaction, about the huge of work that sometimes needed more coordination also. And so we would like to work on this with this project. Then that come in consequence to use resources in a more efficient way and improve the care outcomes in order to maintain a quality of life good for older people, but also to help them to self-manage their condition and their health. Next, please. Yes, the value care actions. So the first one is to provide the patients the freedom to control and self-manage their health with an ICT solutions that I will explain later in a focus slide. And another one, one of the most important maybe, is the engaging of patients, families, practitioners, but also experts in all the care, social and healthcare fields, to participate to co-design activities in order to prepare and have a value care framework. Then another point, another action is to value-based health and social care model in order to create an integrated care plan that could be personalized and person-centered for the older people, but also for the caregivers and all the stakeholders involved in the project. One action is also enabling the realistic collaboration amongst health and social services. So we would like to make this connection between these two types of services and also support the making of this integrated care plan through the artificial intelligence. Another action is to provide the solution for truly integrated care and patient-centered care, and improving also the efficiency of the use of the resources, as we told before, for health and social care. These are the 7 pilots that will test the digital solution in Europe. The project started in December 2019, so we are in the first year, and we are now constructing the framework to implement the pilot also for the digital solution. And as I told before, we have not only dementia, but also other frailty conditions. But in 4 pilots, the pilots will be implemented on mild to moderate frailty and cognitive impairment, also in comorbidity with other health conditions. So this is the pilot. And next, please. This is one of the focus of this presentation, the co-design activities. So what is co-design? Co-design is a collective creativity of different actors that work together in a design development process. It's like to create, we would like with the co-design activities to create the final framework of the project with the direct actors. So this is the most important point, because we would like to focus on what is the value of the social and health care for the actors involved. That means older people and their families, health and social practitioners, ICT, health and social care managers, and also all the experts that could be involved in these 2 systems. And in the first time, the co-design solutions given from our colleagues were the solution in group when we should stay together, and they were national seminars, world cafes, and focus group. So national seminars is an open event to gather the informations to build all the value care concept and solution. And it's national, but actually it will be local according to the different pilot site, but we can also invite national people. Then World Cafes. World Cafes is an informal way to meet together as a cafe setting. This is why the name is World Cafes, and is a way of arising the discussion with powerful questions. So there is a facilitator, but the important is that there is the powerful questions that could enhance the discussion of people that participate. And then focus group. Focus group is a way to gain a deeper insight, information in an environment that in which people could feel comfortable to explain their experience and to share it. The co-design activities in COVID-19 time. Why? Because as I told before, these are participatory activities and projects. So we need to. The COVID-19 gave us the opportunity to find also some different way to do it, to co-design together the value care concept. So the new ways of engaging health and social care experts were to video. So we decided to propose some video to socialize the value care project. So also to engage stakeholders and influencers that could be really important to explain the aim and the object of the value care project. Then the interviews and online surveys. Interviews and online surveys are very important because it's also elicit more understanding of requirement to the value care project. And also we thought about a new way to make people together, to take people and meet together, but on a web-based platform. So we for sure, especially for older people, because if for health, for care experts it's different, and maybe it's easier for them to participate to video, to surveys and interviews and to video conference. We are trying to face if it could be possible also with the older people. And we are quite confident about it because actually I have some experience about it, so I can do this, but the video conference is really important. So the value care digital solution is the other focus on this slide, because as I told before, is a DTH call. So one of the most important framework solution is the digital solution. And it will allow professionals to have access to better and complete information about their patients. So the focus is that this information flows will be improved, creating an integrated care plan for older people that where people, but also caregiver and also professional, could access to it and to have the most up-to-date records regarding the patients and their care. These are some main components. So the digital platform is the main one, but the most important is the ICT, so the integrated care plan that is composed by a dashboard for clinical and for other. There will be an app that will be prescribed to the older person in order to also enhance and improve their self-management of their condition and to be more awareness about it. Then the virtual coach is really important. So there will be an artificial intelligence platform for assessing compliance and for coaching. And then, as I told before, this personal health record solution that could give the professionals the opportunity to have access in time online to the records regarding their patients. And this will be helpful also to set some new items, some new outcomes-based results regarding what is important for people. So these are some final considerations about the ValueCare digital solution, but also the co-design activities. This digital solution was planned, also the project before COVID time, but for sure it will be really important in case like this. So digital solution gives the opportunity to support other people with dementia and caregiver online. This means also less stress for caregivers that sometimes feel alone. And then also it's important for the prevention with self-management of health, especially for mild cognitive impairment, where there are some space to work on it. And finally, it's really important to think and to have thought to this new way of co-design activities, because thanks to web-based platforms, the action maybe will be possible to do. So the problem is that to implement the work, we should do the co-design activities. So we should find some different way to do it and to involve and consider the importance, the role of patients and families in order to release this ValueCare final framework very soon. So thank you very much. I'm here if, as I told before, it's a project that it's in its first time. So here you can find all the information. Thank you.
Thank you very, very much for that, Stefania. Very, very good presentation there about the Horizon 2020 funded program ValueCare, and particularly the information that you provided about the impact of COVID-19 for people living with dementia as well. That's vitally important. So, and again, you can connect up the dots between yourselves and the Eden program and obviously the input from Tunstall as well. Vitally important, and thanks for your presentation. Now we're not going to move very far away now, because we're also going to hear now from my very good friend Oscar, and Oscar is going to talk a little bit about the development of something that's very exciting for us, which is our brand new Italian digital health ecosystem, and a little bit more about ISRA and the activities of ISRA, especially around the field of dementia. Oscar, I'm going to ask you to turn your screen on and unmute yourself. I met Oscar many years ago. We used to collaborate many times on European funded collaboration. And so I'm proud to introduce him now here. Oscar, over to you.
Thank you very much, Andy. Hi, everybody. So I'm Oscar Zanutto, working in ISRA, but is a public care provider organization based in Treviso, working with Stefania, but has already presented ValueCare project, and I'm in charge of FABER, that is our European department working on European projects. So today, what we are willing to present is ISRA and dementia in COVID-19 times, but almost what are we doing about this and how we can launch our ecosystem around new challenges. So we can proceed, and first, we got a specialized dementia center dedicated to people that suffering of such kind of disease. And we take over, say, care and deliver care for 600 older suffering of dementia per years in terms of users and interventions. And we have more than 1,000 home care, psychological support actions and training for informal caregivers per year. It means that we almost give an answer to the need of knowing better what is dementia about, how the behavior could change along time, and let's say trying to make relatives more resilient to the long process of this disease along time. So going deeper about the kind of services that we deliver, the main ones are this SAPAD, that is this, let's say, personalized support and counseling that it's, let's say, very adapted and personalized and tailored around the needs, giving psychological supports, and it foresees a cycle of 8, let's say, meetings at home, delivering a strong collaboration with our local health authority provider. So we join our efforts in trying to, let's say, allow an aging in place for people suffering of dementia. And moving to the Alzheimer cafes, as my colleagues presented, is based on a monthly meeting dedicated to those who are in charge of informal care mainly. And we deliver specific contents, topics, and knowledge, inviting experts that could share experience and suggestions to allow people to be more, let's say, robust in staying together and closer to older. Then we have the neuropsychological evaluation, that is seldom, let's say, a starting point, because as soon as people suspect that something is changing, we need to have a professional evaluation. And then also we look at the behavioral symptoms, providing information. And here starts, let's say, the plan for the support that will run and engage several kinds of expertises along time. And we deliver, for sure, cognitive stimulation in several ways and strengths, also in groups or at individual level, depending on the circumstances. Okay, we can move ahead, please. So how we are dealing with this COVID-19 times? Mainly moving on remote our activities based on Facebook, let's say, so using the social networks. So we deliver this Alzheimer Cafe online every week with huge interest and participation. We are very surprised about the number of people that is joining us, and we are growing up weekly. Then we have a weekly session about books, for example, related to dementia. So it's a way to suggest good lectures about the topic. And also we deliver sessions dedicated to tips and tutorial to provide knowledge and other supports in terms of contents. If you look at the numbers, we are really interesting, because we see that we have several likes, but almost now we are closer to 719 followers, and 4,000 people are reached out through the Alzheimer Cafe sessions, and we almost send out one post per day, sharing within our communities. So let's say this is a way to stay in connection with people. But now moving towards the challenge that we want to share in terms of visual ecosystems and around Europe, for sure, asking for, let's say, collaboration. First, dementia and robotics. So what happens is that we are working about solutions that foresee the use of robotics for the older daily life support at home, but also in the nursing homes. And what we would like to do is first using robots for early diagnosis about dementia based on speech analysis, emotional face recognitions and gestures, and also gait tracking. You know, but this combination of cognitive and motor skills are very early symptoms that something is changing the person. But also we could use speech recognition and emotional expressions in terms of adaptation and stimulation. So it starts from a diagnosis, but it could move to stimulation. Then we have remote interaction in the environmental control from informal caregivers via remote, because we are in closer collaboration with Italian university working on robotics that use robots that could be remote controlled, and they have sensors to move around the apartments and look at the situation, detect risks, fall, and sending, let's say, alarms, and then making the video communication with people. When we have cognitive stimulation foreseen at individual and group sessions, but be done also in nursing homes, and finally gaming, because if we adapt contents for, let's say, the specific psychological level of a person, we can easily, let's say, make it easy to use and challenging for the person. So this is the challenge one. Challenge two is about an important phenomenon, that is the multi-resistant bacteria that are around nursing homes. Let me say very quickly that if you look at the number of deaf people due to COVID-19, it's more than half, as we know, was in the nursing homes. Nobody talks about also this risk that we are, let's say, we have every day, that is the multi-drug resistant organism. So here we present the data and the impact in the long-term care facilities in Italy. It's very high. If we see, we have, let's say, a high impact that is in the range closer nowadays also to 38% of patients that has got this MRSA that is related to the Staphylococcus bacteria. But also the healthcare providers in terms of services are has, let's say, huge impact. Then we have other higher percentage related to other two kinds of bacteria, that are the ESBL and the CPI A. So several kinds of bacteria that are important to deal with. So the next slide, please. We see what happens if you are not able to run such kind of bacteria. First, you have structural criticalities, because you have a problem in running and, let's say, in deliver the right care with right isolation to the person. And also you have a residence management critical point, because the community life for fragile people are compromised. So you need to see how you can manage the person in between hospitalizations and nursing home. And then we have resources needs, because you need more people, more technical equipment, educational training, and so on. So what you typically do is to activate an infection control program. So please, the next slide. It works, let's say, in 3 strands. One is the general objective is to reduce the risk transmissions of infectious agents between guests. The second is, let's say, you need to link the nurse and the team around this topic with specific procedures. And third, you need to have systematic collection of analysis in terms of antibiotic resistance data. So you have a passive surveillance, an active surveillance, and laboratory surveillance, but you need to combine. Moving to the next slide, please. Here we present some benchmarks coming from Italian studies and then to European benchmark studies that has been working on this phenomena. And mainly the first one, for example, was related to this colonization of multi-resistant pathogens in elderly nursing homes. Let's say the focus was about how the bacteria goes around people, and let's say the main reasons why they were, let's say, resistant to antibiotics. Then we have the PAMURSA project that also was done in relation to the long-term care facilities, and the focus was about the measures about the prevention, so how we can, let's say, prevent the phenomena. Moving please to the next, that is the European benchmark. Let me lead your attention to the HUD project, the last one, that is about the European long-term care facilities studies, joining a scientific institute based in about public health based in Brussels with the Emilia-Romagna regions about the health and social agency. So the objective here, it was to have a control of care-related infections, and they promote, let's say, the appropriate use of antibiotics and the reduction of the spread of the impact of bacteria. So the project is not so new, let's say, but is one of the best to look at and learn something about. Next slide, please. So what our ecosystem is looking for, getting the point. First, application research that could have an impact in terms of technological and organizational transformation for detection and to recognize MDRO in older population. Secondly, to improve the employee safety, because we need to consider, as it is in COVID-19 times now, that one of the main challenges is how we can, let's say, protect and build like a shield around the employees. And third, how we can run care transitions, because one of the lack, let's say, in the system, lack points in the system is between transitions that we have towards hospital readmission, moving in private home, and then coming back to nursing home and so on. So these 3 points is what we are seeking and try to work with universities, technical research company, or whoever is interested about this. We can now move to the last challenge, that is how we can automate personal hygiene care for other people. If you are in the field, you know that this task to helping people in washing with the bathroom, with the shower, it happens daily, and it takes more than 30 minutes for each person. Typically, there are 2 care workers dedicated, and 1/3 of the daily workforce is dedicated to this process. So it's very core, very in the center of the care process. We need to deliver the right privacy, the right setting and safety, wellness during these actions. And few previous EU projects has been done to innovate this core process. We know some of them, but there's nothing so interesting about. So the question is, are we able to imagine, to foresee new solutions that could be, let's say, socio-technical solutions based on, for example, speech communication in between the person, the order, and the environment where this hygiene process takes place, and we can make he or her more autonomous in using all the devices related to the hygiene care, so we can improve the satisfaction, the personal satisfaction, the independency, and let's say the privacy, and also we could have an important cost saving for nursing home organization and not only. So this was, let's say, and these are the main challenges where we are in. So if you are interested in joining us, please, we are more than welcome to work together about these topics. So next slide. I'm thankful to all of you, and here you have our contacts. Thank you very much, Andy and colleagues and the CH Alliance.
Thank you very much, Oscar. Great to hear that. And great also some opportunities to connect up some dots very, very quickly because we're running close to time, believe it or not. Firstly, let's connect some dots up with your challenge there. That's a direct challenge for our other ecosystems within the ECH Alliance International Network of Ecosystems. Very clearly there, Oscar's laid out the challenges for what is our brand new Italian ecosystem, Intraviso there, and we hope to be announcing the formal launch of that and providing more information and links there. But you can see there the direct links for our other ecosystems. Secondly, Oscar, to connect you up with our work on the medicines optimization working group that's been led by my colleague Gregor Tuzak, and I'll connect you up personally with him as well. And thirdly, obviously not to forget, many of our ecosystems have got experience of robotics projects, specifically targeting dementia, and we will connect you up with those too, as well as the ones I've personally connected you up with as well. Thank you for that.
Thank
you. Briefly, because we've got a few moments, whilst you're still on, Oscar, before you go, one of the questions we were having was, I mean, we've talked about some of the impact of COVID-19 on the people that you're supporting, but in terms of what have you found the most effective tool has been, considering the level of new isolation that's been introduced in supporting people living with dementia and carers? What do you think has been one of the easiest tools that you've used, Oscar?
Oh, in our opinion, but is let's say a hot topic, is video communication. So mainly what we see is that people need to let's say overcome this isolation in talking with someone, feeling emotions, and to be connected as well. So video communication tool, very simple, is a priority in our opinion.
Okay, thank you for that. Henriette, I don't know if you're still around, whether you've got any input in terms of the value, obviously now the change priorities with the Eden project that you're working with. Obviously that's targeting communities of people supporting both carers and people living with dementia. I don't, Henriette, are you still online? Or
Yeah, I'm here. But I didn't understand your question. What
do you think in terms of some of the communities that you're, that are involved with the Eden project has been, some of the, have you seen any reliance on existing digital tools to offer support for people living with dementia, or has that not been approached within
No,
Eden?
we have not approached that yet, because we are just starting to go into the local communities to test our products. So I cannot say anything about that right now. No, but it was interesting to hear the other presentations as well, and we should definitely try to see if we could if we could put our resources together, and maybe also afterwards, now that you have this this part of your network working with mental health and dementia in ECH Alliance, it could be interesting to go together in that perspective as well.
We know many of our ecosystems focus on dementia.
Yeah.
Many of our ecosystems focus on mental health, and I think it's about the time we start to connect the dots around that, because
yes, exactly.
key ask from our ecosystems and also our members. And obviously we've run a series of events now on mental health and now on dementia. But thanks for that. And we can connect you up. Obviously, South Denmark have got a tremendous record of doing some
of course.
very exciting
Our
programs.
ecosystem will be very willing to do something within that area also, if it comes to it.
Thanks. And Wendy, if you're still on, just briefly, have you seen within Tunstall a rapid rise in the use of existing digital technologies to help people stay connected during these times?
Yes, very much so. So I think what we're focused on is to have existing technology, so integrated health and care solutions, and have that tailor-made to new use cases under COVID-19. With people in social isolation that have improved at being able to connect to people when you're not there physically, focusing on the social part, being able to provide support in very stressful and difficult situations has really proven its value.
Thanks for that. Thanks for that. And Stefania, if you're still on, Stefania, I don't know if you can hear me, with the ValueCare program. I was very interested to see the work you've done there already, and looking at COVID-19. The links and the connections are very clear and obvious for you, I think, with certainly our other ecosystems, and it'd be very interesting to share your knowledge and learning from your project.
Yes.
There with our other ecosystems. And so it's and have you seen there any trends that you've seen of use of existing technologies to combat this level of isolation?
I agree with Wendy that we should use simple platform, you know. So this is why I think that the ValueCare platform could be really helpful. And if I can add something about also our home services that have stopped during this COVID time, it's important also for ValueCare to engage the caregivers. Engage caregivers in using the technology for patients that have dementia, and for them it's really difficult to use the platform, the app also. So it's really, I think, the main point to engage caregivers and have a simple platform and technology tools.
I think, there's obviously, so again, I'm going to connect you both up with the Eden project, because when I first got involved with the Eden project a while ago now, it was vital that we said we don't want to have to reinvent the wheel. A lot of this stuff, there was already good existing practice, and Henriette talked about that, of what works, and we don't need to reinvent the wheel all the time. People who are living with dementia use tools that they feel safe with, and they use them quite often, and despite what we say, and probably more than because of what we say. So thank you for that.
Thank you.
Lots of areas for us to connect up the dots today, and I think an interesting topic for all of us. Firstly, I'd like to thank Henriette, in no order here, and Henriette from the South Denmark office in Brussels, and say hi again, long time no see. Thanks for your input, and thanks for the Erasmus Plus program for funding the Eden program. Also thanks to our strategic partners Tunstall and that very I think it's going to be impactful white paper. You can download that. We'll put links on Twitter for that. So thanks for Tunstall. That's been some time in coming, we know, and I think it'd be a very well used resource, and one hopefully people don't have to think we need to go and do our own study. This is now, I think, demonstrable proof of the value of telecare. Thank you also to the Horizon 2020 program for funding the ValueCare program. Vital research going on there, and I think the connections are there obvious for people who are listening to connect up with Stefania and our project partners, and on our connections obviously with Federica and Natalia as well, who've been involved with that program. And then lastly, thanks to Oscar for telling us a little bit more about the services within ISRA, and especially setting out very clearly, I think, some clear challenges for us to work with our brand new Italian digital health ecosystem there. So we look forward to working collectively with all of you. Thanks to you all for listening, and I think we're in danger of actually ending just about on time. So thank you very much. share this very, very shortly afterwards. Okay, thank you very much. Bye-bye.